So hello, everybody. My name is Sue Paterson. I'm currently Junior Vice President of the Royal College, and probably more importantly, in the context of today's presentation, RCVS Council Lead for Sustainability. Welcome to our presentation, which is an overview of the practice standard scheme's environmental and sustainability standards. Just a little bit of housekeeping before we start. It's lovely to see we've got such fantastic engagement across the whole of the professions. It's great. We've got people here from small animal, and I noticed there's pig vets and equine vets as well, which is great. Can we ask you to keep yourselves on mute throughout the whole of the presentation? Can we ask you as well to keep your videos off if that's possible? Not that we don't want to see you, it just makes it easier when it comes to recording. And we are recording this session, and we're hoping to make that available at some stage in the future on the Royal College website. In the meantime, though, while we're busy doing the IT people are busy doing things with the recording to make sure it's gorgeous, you can actually access the slide set, and there will be a link in the chat, which Joe is going to put in a little bit later on. So if you want to access the slides, you'll be able to do that. So they're all there as a resource for you going forward. What we are very keen for people to do is to ask us questions, and we'll take questions at the end. But if you want to put those in the chat as you go along, again, that's absolutely super. Put those in, and then when you put them in the chat, if you address them to Joe, we have two co-hosts today. One is Joe Stetzel, who is our head of marketing and digital communications at college, and Chloe Baxter, who's our Senior Events Officer. She's actually driving the slide deck for me today. So please feel free to put questions in. We're happy to take as many as we possibly can. We do have a lot of questions already, so what Joe will try and do is she'll try and put them together in some sort of themes for us so we can take those. However, if there's anything that we can't answer, Alice and I will do as many as we possibly can. Then we will take note of those, and we can get back to you at a later stage. So let's get going. To start the process, I'm going to do a little bit of an introduction, just a few slides to start off with. Then I'm going to hand over to Alice, and Alice is our lead practice standards assessor at Royal College, and she's actually going to go through the specific changes that we've got on the standards. So Chloe, if I can have the next slide, that would be absolutely great. So I suppose just to set the scene so far, what do we know about healthcare and climate change? There's been lots of really high profile cases in the press. We've seen them, one of the most obvious ones was back in 2019 when we had those absolutely dreadful bushfires in Australia. And we know that as a conservative estimate, there was 61,000 koalas were either killed or badly injured. And that was amongst a total of 3 billion animals affected by those bushfires, all due to climate change. We know drug pollution is a real issue. We know that we're finding a whole range of different pharmaceuticals in water sources in all of the continents where we have habitation. We're finding antidepressants and painkillers and antibiotics, and we're finding veterinary pharmaceuticals as well, the most prominent of which we know are things like ectoparasiticides. Superimposed on that, of course, we know that there is a huge desire amongst the professions, both vets and nurses, to be more sustainable. And you've got a reference here to a BVA survey in 2019, which shows that 89% of vets wanted to become more sustainable. So Chloe, if you put me the next slide up. And college were very aware of this. And of course, the great thing about the practice standard scheme is that it's a voluntary scheme, but we have 2/3 of UK practices who are members. So it seemed to be the obvious conduit in which we could actually provide resource and guidance and help to practices across the spectrum, from small animal right the way through to poultry and in between, to be able to guide people around how they can work in a much more sustainable way. And that's what we're going to discuss for you today. We're going to discuss the changes that we've implemented into both core and into GP standards. You put the next slide up for me, Chloe. This is just an indication, really, and this is taken from this is a primary care small animal practice as to where those carbon hotspots may lie. And you can see there's some really big obvious ones there. So things like energy supply, so gas and electricity, make up a huge component of that practice's carbon footprint. But there are other things that we can really do a lot to influence. And if you look there, you can see that anesthetic gas use, isoflurane, again, is a really huge contributor to that practice's carbon footprint. And that's one of the things that Alice is going to talk about a little bit later on when we look at some of the new changes to the GP standards. And just to give you some figures, I pulled out a paper from the human literature when I was doing a little bit of reading around this presentation, and they look at the greenhouse gas effects measured in carbon dioxide equivalent for what's called 1 Mach hour, and that's a measure of anesthetic potency. And they compared all the different anesthetic agents, and they looked at it in terms of kilometers driven. And if you look at sevoflurane, it's 6.5 kilometers. If you look at isoflurane, which is what many practices in the UK use, is almost double that at 14 kilometers. And although there's no nitrous oxide on this particular pie chart, nitrous oxide accounts for 95 kilometers driven. So there's a lot we can do in a practice concept by, looking at reduction in nitrous oxide, looking at the ways in which we use our anesthetic gases. And that's all encapsulated in the changes we're going to discuss. Next slide, Chloe, please. So this is the framework on which a lot of the work's been done. We've been working very closely with the Centre for Sustainable Healthcare, and it starts, as you can see, on the left-hand side with us looking to reduce our carbon. But what we have to say when we're looking at reducing our carbon is it's really important, as our responsibility as veterinary professionals, that we don't compromise animal health and welfare. And of course, because we are an evidence-based profession, what is also really important is there needs to be an evidence base to support what we do. You can subdivide that reduction in carbon by reduced activity and by reduced intensity. And we're looking at reduced activity again. Alice is going to discuss this in more detail. Preventative healthcare, education of clients to empower them to work in a more sustainable way are important. Things like lean pathways are also really important, and I would direct you to a really excellent resource that's now available on the Royal College Knowledge website, which talks about lean pathways, looking at ways in which you can reduce waste. So looking at keeping stocking to a minimum, reducing waiting time, reducing errors, improving workflow, reducing movement, reducing duplication, streamlining processes and paperwork, and realizing human potential. So the eight, if you like, cornerstones of the way in which we can work in a much leaner way. It's a really nice document I direct you to. The other part of that is reduction in carbon intensity. And again, there's lots of things we can do. If we look at low carbon alternatives, there are things like reusable scrub hats and reusable sharp bins and reusable surgical drapes. We can actually look to lower plastic alternatives, and we know that you can use green or bioplastics for things like syringes and things like disposable gloves. One of the questions that came up in advance of the presentation today was looking at evidence-based to support the use of some of these reusable things. And I pulled up just as an illustration for you. There's a really nice article in the Journal of Orthopedics from 2018, which compares the risk of surgical site infections using both disposable drapes and reusable drapes. And it shows there's no difference between the two. So again, an illustration of the fact there's potential for us to become more sustainable, work in a more sustainable way with an evidence base to support the way that we work. And then the last part of that is obviously referring to estates and operations. So things that we do in a practice situation. So things like low energy light bulbs, things like fleet mileage, which again, Alice is going to talk about, and just things like changing the flushes on the toilet. So you just got a low water flush on those. So lots and lots of ways in which we can be much more sustainable as professionals. Next slide, Chloe. So key changes, which Alice is going to go through. We've got 1 change to core requirements and 8 to our GP requirements. Those are in our sustainability module. And at the end, I'm just going to talk very briefly about the 2 changes to the medicine module, which are around ectoparasites and endoparasite use. Next slide, Chloe. The thing that we need to be aware of course, is these are focusing on environmental sustainability, not on social sustainability, but they are divided up into both clinical and non-clinical areas. So we would hope that you would start to look at both of those aspects of your practice working when we're looking at working in a much more sustainable way. Next slide, Chloe. So again, bringing the requirements to life, I'm going to hand the baton to Alice in just a second. She's going to introduce herself to you, but these are the things that we're going to start off by considering. We're looking at the incorporation into core of a written environmental sustainability policy, and then two of the big ones within the GP standards are the appointment of a sustainability champion or a team. Many practices already have this, and also we're looking at that there needs to be some way in which practice team members can suggest sustainable ideas for improvement. So with that, I think that's my last slide. I'm going to hand you over to Alice, who's going to, yes, Alice is going to take the baton from me. Over to you, Alice. Thank you.
Thank you, Sue. I'll introduce myself. My name is Alice Duvernois. I've been a PSS assessor for over 5 years now and have been lead assessor for the last year. So I've been involved in the implementing of this wonderful new addition to the standards. And thank you for the intro, Sue. What I'm going to do is just go through each new standard one by one and just sort of get you to understand the reasons and the ways, but more importantly, the ways in which we will come in and assess these to hopefully, I mean, most of these things we believe that a lot of practices are already doing, but to highlight them with an environmental sustainability light, basically. So the first requirement is a core requirement. So this will mean that all practices under the practice standard scheme will need to comply with this. This is that the practice must have a written environmental sustainability policy. To achieve this, the practice needs to have a sustainability policy which shows a senior commitment. So what we need is for this to have been discussed and signed off. Now, I do appreciate that this could be done in large organizations at a far more central level, which is absolutely fine. But what we do look is for a commitment to reducing the impact of the service, and really for team members to have a backdrop to start making changes appropriate to their own practice. The policy should be able to be viewed by members of the public. So ideally for this to be part of the website content. And obviously the policy should be shared with all the team members. So this can be in various ways that the practice generally communicates, but meetings, emails, it could well be that, you know, and we'll move on to sort of green teams and all the rest, but it could be that the staff room has a green team poster board and that the policy is there for anyone to be able to read through if need be. As part of a key resource, there is a link currently on the PDF, which is published on the website, which will take you to the PVA website and has some really great step-by-step ideas as to how to create a policy. And we will look to have a policy template for when these standards go live. Next slide, please, Chloe. So the GP accreditation levels go into a little bit more depth and detail as to what we are looking for practices to engage with. The first one is that the practice has to appoint a sustainability champion or create a team. Obviously, this will depend on the size of the team. There's, you know, we're not expecting practices to have huge teams. It can be that this is just one person, and I'll, as mentioned in the below notes, practices that only have one vet, that one vet being the champion is absolutely fine. We would like for this sustainability champion to be named in the sustainability policy, as this will signpost assessors who to speak to, hopefully on the day of the assessment, to get an understanding of their role. If you are lucky enough to have a green group or a green team, again, the assessors would love to engage with them and have an understanding of how often you meet, which in what is discussed, what objectives or actions are underway, and if there are a team, ideally we would like to see for the teams to meet once a quarter, 4 times a year. Next slide, please, Chloe. So the next requirement at GP is that the practice must have a system in place for team members to suggest sustainability ideas and improvements. So this is about having a framework or a system where people are given the time and resources to share. Now, this we will mainly as assessors come in and speak to team members as to how this is done. This could be done in a variety of ways, again, based on the size of the team and the physicality of the premises and how busy everyone is, which currently everyone seems extremely busy. So this could be in a way of having a suggestion board or a box in the staff room for people to freely put in ideas. An opportunity on meeting agendas, so practice meetings, if those occur on a quarterly basis, if that's the easiest way to capture everyone there, to have an agenda point, as many meeting agendas will have health and safety and staff holidays and whatnot, to have a sustainability agenda point there to, again, give members, not just of the green team, but the entire practice team, the opportunity to come up with ideas or perhaps, things that they've seen in their day-to-day work, but actually then have the forum to be able to address those and raise them. Another way could be that if there is a very large or strong green team, for all their ideas to be suggested directly to them so that those issues and ideas can be discussed at the green team meetings. And again, if you are in a very small or solo vet practice, then the sustainability policy will be deemed as enough, and the assessor will just want to engage with that person if possible on the day, just to get an understanding how they approach the team and how they get engagement of ideas and improvements going forward. Next slide, please. The next requirement, the practice communicates its sustainability achievements to its clients. So again, the practice must have evidence that these achievements are being communicated. Now, this again can be done in various ways, in the very similar way that a lot of other matters can be shared with clients. So information on the practice website, any social media posts that they might be doing. Again, some waiting rooms will have large post areas. Some practices will have TVs where they're able to share information or projects that are going on within the practice. Or again, just if newsletters, the way that you do it, then keeping clients informed as to some of the initiatives or projects or changes that you've made to show that you're aware of sustainability, of environmental sustainability, and of anything that you might have achieved. Next slide, please. So the next one is for routine appointments to and for clients are planned to reduce mileage. So with this one, there's no physical evidence. What we want to be able to see is for practices to show an awareness of either their own fleet mileage or alternatively of their clients' mileage. So having an understanding of how far are clients coming to the practice, if it's a small animal, or where are the clinicians going when they're on the road. As I say, that there's no strict measure of what that's going to look like. It's really just looking at practices, having an awareness and looking at ways that they can minimize any greenhouse emissions gases. So for example, here we have a small animal example. So one is consolidating appointments to avoid unnecessary journeys. So for example, if you know of a client that is on routine medications, whether perhaps consolidating them, collecting that medication, being done at the time of another appointment, reassessing the need for rechecks, perhaps utilizing telephone checkups instead of, automatically coming in for a recheck that may or may not have been necessary. From a farm or equine perspective, where vets are on the road, looking at creating area days for planned routine appointments. Obviously, there'll always be emergency appointments that can't be helped, but where there is routine work, to see if you can allocate vets to certain areas to minimize mileage. Car sharing for planned appointments, and obviously there's always the opportunity for telemedicine to reduce the need for driving. Next slide, please. The practice advises clients to return unused medication to the practice for appropriate safe disposal. So as Sue mentioned earlier, a huge impact on the environment is medication being flushed down the toilet, poured down the sink, or alternatively being thrown into residential waste, which goes to landfill. There is a huge impact. Some of you may be aware of the NHS Midlands antibiotic amnesty in November of 2022. I believe BVA and many veterinary organisations joined in encouraging the return of antimicrobials, veterinary ones to veterinary practices, or signposting to NHS pharmacies for human antibiotics. And off the back of that, what we're looking at is really for practices to encourage the clients to return the meds to them, as opposed to disposing them in ways which have a very drastic impact. So again, the way that we're going to assess this is really just checking that communication piece is there. There's no strict approach. It could be posters in the room. It could be that there are emails being sent out to clients, again, social media or websites, website posts, for team members informing clients when they come and pick up prescriptions to say, by the way, if you end up not using the end of this particular course, then please can you return to us for appropriate disposal. So there are many ways, and as I say, it's really just an awareness and an encouragement. I know many practices will often historically not want to have returned medications on the premise that the environment in which that medication has been kept is out of the practice's control. It's definitely not in a case of a refund, but more of a return for appropriate disposal. Next slide, please. So the next standard is for the practice to demonstrate that they employ techniques to minimize anesthetic gas usage. So again, I believe this is something that a lot of practices are doing already. But what we are looking for is an awareness of the environmental impact of anesthetic gases. And we're just going to start to talk to various team members about which ways, it could be more than one, but at least one way in which they are addressing minimizing those gases. Some examples here are the use of local blocks or regional anesthetics where appropriate. Where those have not been done routinely before, we would encourage practices to have some kind of standard operating procedure or training for the team members to be able to do that safely and confidently. Optimizing flow rates. Again, it may be that guidance or training on flow rates for the practice team is needed. Reducing nitrous oxide usage, switching to SIVO from ISO. There is evidence that reduction in use, and evidence of that reduction in use. So again, the assessor, rather than necessarily just looking for an SOP, will more than likely speak to your clinical team and have an understanding of how they may have made changes. One last suggestion is increasing the use of partial intravenous anesthesia or total intravenous anesthesia where clinically appropriate. And if, again, this was not something that was done in the past, we would just make sure that there is sufficient training or SOPs to make sure there's consistency across the team. Next slide, please. So the practice must provide resources on preventative healthcare. Again, this is something that we find veterinary practices do a lot of. This perhaps is done less so in human healthcare, but it felt right to make sure that practices are at least offering more than one service in that way. It's been shown that preventative healthcare decreases the need for further treatment later down the road. So things such as information on websites, resources on preventative healthcare, so whether it be around vaccination, puppy education, it could be clinics offered by the nursing team on obesity clinics, diabetes clinics, pain clinics. There's all sorts that's available there to really educate clients and really work on that preventative piece for all patients to minimize the need for more intensive care at later date. Next slide, please, Chloe. So the last one is probably the one that's raised most questions, is the practice that undertakes a waste survey at least annually and can demonstrate, my screen's just gone a bit funny, and can demonstrate that the results are analyzed where appropriate and action has been taken as a result. So again, there is no set way that this needs to be set out in terms of templates, but what we're looking for is for the practice to understand where their waste is going, how well they're segregating, are they recycling what they could recycle? Is there, for example, a particular item that is being thrown away frequently that perhaps could be minimized? Is there a particular item that actually comes with a huge amount of packaging material? Could that potentially be swapped to another supplier that uses less materials? All these things are to be taken into consideration. So the survey should show a review of the practice waste facilities. So what bins are available, how are they labeled, which rooms are they in, how accessible are they, does everyone understand what these bins are, and any resulting findings and actions. So really what we're looking for is that for the assessor to discuss the waste survey results with the team members, and just to understand what were the findings and what actions were taken. We're not looking for everyone to what we're looking for is a review of what is currently happening, as opposed to setting high objectives for everyone across the board, but just some kind of awareness of what is currently happening and improvement on that. We've put a note in there: assessors are not expected to look through the bins to check for correct waste segregation. That's not what we're there to do. We would like for the teams to do that ahead of time. And this is really around, as I say, sustainability, as opposed to, obviously we have got a waste standard in module 16 that looks at hazardous and non-hazardous and pharmaceutical, but this is really about streamlining and segregation. Next slide, please, Chloe. So this is an example of a waste survey sort of steps in action, just to demonstrate some of the things that we're looking for. So for example, one section of the survey can be reviewing your practice waste facilities. So do you have enough of the recycling bins, and are they labeled? Is it a yes or a no? It could be that you guys are doing that brilliantly already. And, is everyone there aware of what can be recycled? Are some of your team members putting in the wrong types of materials in the wrong types of recycling bins? Checking for correct segregation, so kind of touched on what I've just said, domestic and recycling waste streams. Wearing the right appropriate PPE and have a look through the bins, record the types of waste within them, and identify the types of waste that you have most of, least of. Is there waste in the domestic bin that could be recycled, and what are the most commonly disposed of items that could be reduced? Because then some of the actions can be labeling the bins, having lists of things that should go in what bin. And as I mentioned before, could you reduce the amount of items that are being disposed of excessively? And again, checking correct segregation with hazardous waste streams. So talking to team members to understand what they're disposing of, to ensure items such as packaging are not being disposed into hazardous waste streams that could go into domestic and recycling bins, which have a lesser impact on the environment. And of course, as always, we'll talk to practice team members and get an understanding of where improvements can be made, should be made, and just what used to happen and what is happening now is effectively the essence of what we're looking for here. And I'm going to hand back over to Sue for the next couple of slides, who is the expert in the field. So it only makes sense that you deliver those.
I don't know about expert in the field. But I'm quite passionate about the use of ecto and endoparasiticides. Thank you, Alice, for that. So these two are both in core, and these are around ectoparasiticides, and the next slide is going to be endoparasiticides. And I think what's really important with this is all based around a risk benefit analysis. What you've got there on the slide is you can see some really good resources there, and pretty much all of the species divisions have got resource which I would direct you to. So you can see there the BVA, BSAVA, BVZS policy, but I know the stuff on the BCVA, so cattle, equine, I'm sure the stuff on the other production animal websites as well. And what I did again when I was doing a little bit of reading around for this presentation, I pulled out what I think is a really useful phrase from that BVA policy, and I'll just read it out to you. It says, vets have a duty to responsibly recommend and prescribe appropriate parasiticides to clients to protect animal animal health and welfare, and ensure public health is protected from zoonotic parasites. So this is all about trying to juggle all the balls and keep the balls in the air at the same time. What's really important, I think, is looking at individualized treatment when we're looking at animals under our care, whether it's a cow or whether it's a cat. It doesn't make any difference. And what that means is not using blanket treatment, I would suggest. It means looking at factors like the animal, looking at factors like the owner capability, the owner finances, looking at the environmental impact of the products that you're going to use, looking at the environment in which the animal is actually living, looking at the animal's lifestyle. Use some of the fantastic resources that are out there. If you go onto places like the SAVSnet website or the Vet Compass website, you can actually pull up things like lungworm maps, which tells you high-risk areas of the country, which allows you to do some informed decision making. I think that's really important. And then, of course, looking at the diagnostic tests to support your decision making. Things like worm egg counts are really important as well when we're looking at endoparasiticides. So for both these two core modules, what we're looking at is that the practice should develop both an ecto, and on the next slide it will say an endoparasiticide policy, and that needs to be something that's visible to all members of staff. What's also great is to show engagement with clients, and there's lots of ways in which you can engage with clients. It may well be, we know nurses are fantastic at producing stuff in the waiting room, displays and things about the need to be prescribing responsibly. It may well be that, particularly if you're in small animal practice, you make use of some of the really good client decision-making tools that have been launched by some of the pharma companies. There's at least two that I know of that can help clients actually look at the reasons behind why you're suggesting the products that you're actually using. And they may be something you might direct clients to before a consultation, so you can then look at some collaborative decision making when they come in to see you. So we need those inputs around policies. We need to see evidence that you're having conversations with clients. And then what I would suggest the assessors will want to do is look at triangulating those inputs by actually chatting to members of the team, chatting to vets, chatting to nurses, chatting to receptionists to see that they're aware that those policies are in place. So that's the ectoparasites. Claire, if you go on to the next slide, that's endoparasites. It's pretty much the same. Again, it's all around putting those policies in place. And those are policies that should be made, you know, again, collaboratively with discussions amongst the whole of the practice team. So the whole of the practice team buys into these, and the whole of the practice team is aware of what's actually going on. Again, there's references there for you. I've already mentioned the BVA, BSAVA, BVZ Ed one. There's also lots of other stuff that if you pull up these slides afterwards, they'll direct you through with the links that are there. So I hope that these aren't going to be too onerous. These aren't meaning that people aren't able to use health schemes anymore. It just means they need to be individualized health schemes. And I feel very strongly, with my dermatologist hat on, that the needs of individual animals are often very, 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 very different. And that, I think, is what we need to consider when looking at responsible use of all these products in a practice environment. So that's my two slides on core level of ecto and endos. Alice, I think you're just going to look at assessment for practice, and then we're going to go to some questions after that. So back to you, Alice.
Thank you, Sue. So lastly, we're going to cover how the new standards will be assessed as part of the PSS process. Now, hopefully, I've appeased your any concerns just through having gone through the slides previously of what our approach will be. In terms of the new modules the new module coming in, these will go live on the 1st of June 2023. These will go live on Stanley on that date. What I will say is I appreciate some of you may well have your assessments booked in June, July, which we appreciate gives you very little time to potentially do any form of uploading. There's just the one document required, which is the sustainability policy at core, and an additional 4 documents at GP. None of these at the moment will necessarily need to be uploaded ahead of the assessment. The assessors are more than happy to look at all these on the day. Again, just a reminder, this is not a pass-fail exercise. Part of PSS process is very much for us to come in and help support practices where there is any need for help, or how we can give you any top tips. So all I would say is, you know, we are this is new to our team as well. We are hopefully the new standards are incorporating a lot of clinical ways. We're not expecting anyone to be you know, an absolute sustainability whiz. It's really just making sure that we are all doing our bit. So from an assessor perspective, as I say, please don't be afraid to ask questions ahead of the time. We are very much looking at premises individually in terms of any improvements that can be made. But if you at all have any questions, either that we can't answer today or that you need to give, you know, you need to ask your individual assessor, then please always make contact with either myself or the PSS team, as we do appreciate that this is an additional module, and we appreciate the practices are under a huge amount of pressure at the minute. So we will help in any way that we can. Just a little, I believe this may well come up, but just so you guys are aware, there's also a sustainability award that was up for grabs from January. We're in the process of working with one particular practice as a pilot, and this is certainly something that we would encourage anyone to apply for. It only involves the sustainability module, which means that core practices that have a real passion and desire to go for a sustainability award will be able to do that, so long as they satisfy the GP accreditation standards, as well as their core ones within that specific module. So I believe back to you, Sue.
Okay, so just a couple of resources there that you might be interested in. The Vet Sustain website is a great source of information. BVA has got an enormous amount of information there. Alice has already referred to that. And then, of course, all the species websites have also got an awful lot. Many of these have got sustainability leads as well and can help and guide you. I think that's about all of our presentation finished. I know we have some questions, and I suspect we've had some questions coming in throughout the presentation. One of the things that we will aim to do is, as I say, answer as many as we can today. And I'm probably going to direct most of those to Alice, because she's the font of all knowledge when it comes to practice standard scheme. And what we probably, I would hope we'll be able to do at some stage is incorporate a lot of those into frequently asked questions, which will go as a resource on the college website as well. And as Alice has already said, this is very much a matter of college guiding and helping people. This isn't college there with a big stick beating people. We know that people want to be sustainable, and this is college trying to help people to be more sustainable in the way that they work. So, Jo, have you got some questions for us?
I do have some questions. The first one, Alice, you already touched on, but it might just be worth revisiting, please. The first question is, when can I upload my evidence to Stanley?
Okay, so if your assessment is coming up and your event on Stanley has been created for your upcoming assessment, the sustainability uploads will only be available to do from the 1st of June, which is when it all goes live on the system. But please do not fret, as if you are either unable to, or your assessment is at the beginning of June. As I said, our team is totally understanding of the fact that, due to the fact that this only goes live on the 1st, just have those bits of paper available on the day, and that is absolutely fine.
Thank you. The next question, how does this align with investors in the environment?
Okay, so really good question. Obviously, all with the same common goal. There is no current direct mapping between the two. However, as part of PSS, we do review the standards on a 5-yearly cycle, the next review being due in 2025. When we do come up to the review, we will look at potentially aligning so that there is a better link between the two.
Thank you. Can I go, in terms of the award, there are a couple of questions about that now. Can I go for a sustainability award if my practice is accredited at core standards?
Yes, as long as before we were to go ahead and do the award, we would need to do an assessment on the GP points, which would come as part of the assessment. So we would come on the day, go through the GP points that we have gone through today, and then go on to doing the award points within that module.
Thank you. The other question I think you already covered. There was quite a general question about what's happening with the Sustainability Award, and I think you already mentioned the pilot.
Yes, we've got a pilot booked in for May. There was a lot of interest. The reason why we haven't been able to go ahead with quite as many is, unfortunately, a lot of the practices that were keen, it clashed with their accreditation. And again, it's probably worth reminding everyone, the only time that a practice can apply for an award is when they've gone through their accreditation process and are fully compliant with that. So if there are any outstanding standards or points that need evidence, unfortunately, we can't then open the award. It needs to be, that all needs to be wrapped up. And as I said, a lot of the other practices, there was a bit of a clash. So I feel like there's going to be a lot more happening in the second half of this year, which is really exciting.
There's another related question. We had our reassessment for PSS last year and have our awards reassessment scheduled for this year at the end of June. We'd like to go for the Sustainability Award. Will we be able to have the core and awards assessments at the same time?
Unfortunately not. So the accreditation process is separate to the awards process. But what I would suggest to you is, if Joe, I'm not sure if you want to give the person who asked the questions my details, and I can certainly we can discuss and look at dates in a little bit more detail for sure. But the awards and accreditation assessments cannot happen on the same day.
Thank you very much. It's a more general question now. What are things that we can do in practice, not just big office related things, to help sustainability?
Shall I take that one? I think we did some sessions at BSAVA last week, and I presented the slides that you've just seen, and lots of people were coming forward with so many great ideas. And what seems to be a really common one is looking at ways in which you can, if you've got a car park, which a lot of practices have, or just a space outside the practice, and using that to look at rewilding and putting bird boxes up and putting bee-friendly plants in. There's loads of things you can do around that, which is really good. And somebody also gave me and they couldn't give me the link, which was really disappointing. They were talking about an idea which I think one of their nurses had found, where they were using hair that had been clipped off animals that was sterile hair, so from elective procedures, and they were recycling hair and sending them to be made into things, mats and things. So there's loads of stuff that you can actually do, and just little things, as I talked about before, like looking at the light bulbs, looking at the flush on the loose, looking how much paper you use. So paper use is really massive in these things, and things like encouraging staff to come on their bicycles if you can, rather than coming in the car, looking at rationalizing CPD. You know, do you really want to go to that face-to-face? Could we do it virtually? If you're traveling to that meeting, can you go by train? Can we go by public transport rather than going by car? There's tons of stuff we can do in our day-to-day lives, as well as just, you know, looking at reusing drapes and reusing surgical hats and things.
Thank you. The next question: if the practice is part of a corporate that has an environmental sustainability policy, is this sufficient, or does there have to be a practice specific one too?
No, that's a great question, and it's one that I know we've been asked a lot of times. No, a corporate wide policy is absolutely fine. I think what the key point here is that it has been communicated effectively to the whole team, that it's not just words on a piece of paper, that as I say, it's been brought up in team meetings, it's been emailed, and everyone sort of understands how that relates to the way that they work day to day, and sort of instigate conversation. So at a core level, absolutely a large organization one is ample. Thank you.
How complete do you expect clinical notes to be with respect to conversations with clients re ecto endoparasiticides?
I think there just needs to be an indication that you've had that conversation. I mean, it doesn't need to be, and it will be the same with a lot of the other stuff. I mean, one of the other things that the assessors will look at, will be looking at antimicrobial use and looking at antibiotic use. So again, there needs to be an indication that if you prescribe a product, and Alice will correct me if I'm wrong, that you can justify why that product was actually prescribed. And that's a conversation, but perhaps a note on the records which may say fluoroquinolones prescribed due to resistance to, based on culture and sensitivity results, or this particular ectoparasiticide prescribed as dog doesn't swim, or something like, I don't know. So a justification, very brief notes would be what I would suspect would be useful. Alice, would you agree?
Yeah, absolutely. Absolutely. I think in terms of ecto and endos, you know, again, looking at the individual patient and the needs of the owner, you know, it may be that, you know, as Sue very correctly mentioned, you know, animal welfare still has to be the first and foremost, but just starting to think a little bit outside the box of just blanket treatment is key. And assessors will be keen to engage with multiple members of the team that are involved in that process. In terms of clinical notes, as always, just being able to write justification, as Sue's mentioned, is great. You don't need to write an essay about why or why not.
So, for example, there's parts of the country down in the south of England where lungworm is a real big issue compared to perhaps areas up in the top of Scotland. So in those areas, you know, the justification for your prescription of particular drugs will be based on incidence of disease. So you just need, you know, the fact that the practice is in a high lungworm risk area, that would be enough justification to explain your particular policy and why that's actually implemented. So again, that would be in your overarching policy document that the assessors would be able to see, that would then justify the way in which those drugs are used. So there's lots of ways in which we can triangulate that.
Thank you. The next question. This seems to be very much directed towards local practices. Does it impact hospitals?
It does, in the sense that there are no hospital requirements for sustainability at the moment, but obviously all hospitals need to meet core and GP. So because the sort of accreditation levels are cumulative. So does that answer the question?
If the person who asks the question could let us know, that would be great in the chat.
Yeah, I guess what I'm trying to, the answer is there is no hospital accreditation, or there's no hospital specific requirements at this moment in time, just the core and GPs, which hospitals have to meet anyway.
Great, thank you. I'm not sure that you'll know the answer to this, but I'll ask it anyway. Are the corporates aware of the new requirements regarding endo and ectoparasiticides? At present, we are told what we need to prescribe.
Yes, they should be. This is something that there's been discussion, and we do appreciate that a lot of the pet health plans can be restricted. So again, we will look at individual practices with whichever freedom. But again, I think this is an opportunity for us to push back on any sort of blanket treatment, and especially with this coming into PSS, if corporates aren't aware, then they will soon will be, when practices are, you know, recommended that they take a slightly more patient-led approach as opposed to a pet health plan approach. So it's a really good question, and as I say, this is I'm glad we're starting that conversation. So if there are any that aren't aware, or practices that are feeling a lot of pressure one way, then we can come in and help drive that change to a more responsible use.
Thank you.
As far as I'm aware, Joe, pretty much all the corporates have got individual sustainability leads, and I'm fairly sure they're all aware of the upcoming changes. So I do think it's there. I just think it's a matter of people getting their head around it and deciding how they can best put those changes in place in order to obviously protect their business model, as well as maintain animal health and welfare, and look at our responsibility as professionals within the environment.
Thank you very much. How do we open the award?
That's a good question. At the minute, the best ways to email the PSS inbox. We're keeping a list of practices that are interested. As soon as the accreditation, the sustainability module becomes available and is not grayed out on Stanley, or it's at the minute grayed out on the PDF, but it's not currently on Stanley, the award button should be on there. I say should. When these things go live, there can always be a concern, but the best way to lead us with your interest, let us know of your interest, is to email us first of all. And as I say, from the 1st of June, there should be the award button on Stanley if you are currently on Stanley.
And Alice, is it fair to say you've been overwhelmed by the number of people who are keen to? Yeah, it's been fantastic to see.
Yeah.
engagement.
It's absolutely
and,
overwhelming and wonderful, and the number of people that are so engaged and keen. I've even had practices sort of say, is that it? Is this it in terms of the accreditation? We want more, we want to do more, and the award is a real opportunity. And I think for anyone who wants to learn a bit more, whether you want to do the award or not, it's definitely worth reading through the award points and looking at where, you know, the future or the goal could be in terms of some of the things that can be done. So yeah, it's more of a case of us being able to find the time and making sure we've got the right assessors to send out to do the awards. So yeah, it's been really positive.
And Alice, just remind us what when people get the award, what sort of recognition do they get from that? Is there a logo or something that goes on the website? Is there a shiny badge? There
is an award. So as with other awards and accreditations, that there is a certificate. I believe you can purchase a plaque for the practice. In terms of marketing content, as I say, I think this is under review at the minute as to what we can provide, but we do appreciate that with awards people want to celebrate. I mean, we've had practices make banners and for the front of their practices. So again, yeah, there's I believe, and again, I believe it through Find a Vet, there's an accreditation and the awards are marked on there. For the sustainability one, I might have to come back to you once we've done it first time.
Thank you very much. This is the final question. Our PSS inspection is due in June, but we haven't yet heard from the RCVS about booking it in or getting access to uploading documents to Stanley. When should we expect to be contacted?
So, Joe, I think in this instance, if you can give this person my personal details and we can discuss, all June allocations should have been given their assessor. So if you're due in June, have not been contacted, it may be due to the fact that we're still dealing with a backlog. So we will come to you as soon as possible. But I think that's probably one that's best done offline, one-to-one. So I don't know if, Joe, if you can give them my personal email and contact them directly, and just to check where they're at.
Yes, I will do that. We just had one final question. We've just had our assessment. Will it be 3 years before we'll be required to do this again?
Yes, so 4 years. So anyone prior to the 1st of June, the next bit, and again, we would always encourage practices to look at this edition and be, you know, striving to introduce it. But in terms of us assessing it and being required, it will be in the next 4 years when your assessment is next due.
That's all of the questions. Thank you very much, everybody.
Okay, well, so thank you. My closing remarks. Thank you, Alice, for your knowledge and wisdom, as always. Much appreciated. Thank you, Joe, for fielding the questions, and for Chloe for doing all the slides and stuff. Just to remind everybody, there is a link in the chat to the slides which are on the RCVS website. There's more resource coming soon. The college are really keen to support people to be able to be as sustainable as they possibly can. Thank you, everybody, for your time and your engagement. I'd say we've been overwhelmed by the number of people that registered for this, and having so many people live again is really great to see. It remains for me to say thank you very much. Enjoy the rest of your day, and we'll see you all again soon. Thank you, everybody.
Thank you, Sue. Thank you, everyone. Bye.